Okay.
Our patient is LW, and today we'll be discussing her case on ARMD. My name is Urvashi Patel, and I'm a second year optometry student.
And my name is Tom. Our patient today came in. Her chief complaint: I'm unsure about my new medication, and the history of her present illness is that she's an 85-year-old Caucasian woman. She came in today to review her medication therapy, specifically concerning the care of her eyes. LW was diagnosed with age-related degeneration 10 years ago and has recently been changed to a new set of medications to prevent the progression of this disease.
Her ocular case history showed that she had cataract removal surgery in 2003. Intraocular lenses were placed in both of her eyes, and as mentioned, she is positive for dry macular degeneration, and she's negative for any sort of glaucoma, retinal detachments, eye injury, and she wears glasses for near vision only, and those are +2 readers in both eyes.
Patient's review of systems: positive for hypertension and urinary urgency. She's negative for diabetes, coronary artery disease, cancer, or dyslipidemia. She does not smoke or drink alcohol. Past medical history: again, hypertension, macular degeneration, and a diagnosis of overactive bladder syndrome. Her family history: she is positive for breast cancer on her maternal side, and pertinent social history is that she does live alone. She does require help driving at night due to vision issues with the glare and the lights. LW does not have any known drug allergies, and she is currently taking the AREDS 2 with lutein formula. She takes 2 soft gels by mouth daily. In this formula, there are vitamin and mineral antioxidants. Vitamin C is the 250 milligrams per 1 soft gel. Vitamin E, 200 units. Zinc, 12.5 milligrams. Copper, 0.7. Lutein, 5 milligrams. And zeaxanthine, 1 milligram. LW also takes folic acid 1 milligram, PO daily, and fish oil 2,000 milligram capsules twice daily for her eye care. She's also on lisinopril 20 milligrams by mouth daily and furosemide 20 milligrams by mouth daily for her hypertension. She takes aspirin 81 milligrams by mouth daily for primary prevention of CVD, and tolterodine 2 milligrams by mouth daily for urinary urgency. A little bit more about her switch to the AREDS 2 formula. The antioxidants, vitamin C, vitamin E, and beta carotene were shown to reduce the progression by 25% in macular degeneration. And however, the higher zinc dosages in this AREDS 1 formula showed had high GI side effects. So in the AREDS 2 formula, we did the zinc dose was lowered, and the beta carotene showed a higher risk of lung cancer in smokers. Our patient LW is not a smoker. However, the potential of increased safety, no decrease in efficacy, is worth this change. Sort of, and all that.
So her subjective ocular exam showed that the patient has not experienced any recent vision changes. Her central vision is, however, slightly reduced in both eyes. She has small scotomas on the central AMs that are good. There are no symptoms such as flashes or floaters or any diplopia. Her VAs show that without any correction in the right eye it's 20/30, left eye 20/30. All other preliminary tests were unremarkable for this patient. For when doing the biomicroscopy, any findings were unremarkable. On the ophthalmoscopy, a 90D lens was used to look at the fundus, and the cup to disc ratio of the optic nerve was 0.3 0.3. This is for the right eye and the left eye as well. The color of the optic nerve was pink and healthy, margins were distinct, and vasculature was 2 to 3. Macula, however, did show areas of hard drusen, which correlated with ARMD, and the periphery was clear. ARMD has not progressed to the wet form in this patient. She is still stable at her current disease state. She is tolerating her medicine and is well informed on indication and adherence.
There are no contraindications to her therapy, and she is not taking anything inappropriately or unnecessarily at this time.
So with the differences between the wet versus dry ARMD, with the dry form, we would see drusen. This is also the more common form of ARMD. There is slow progression, and the normal findings of visual loss would be anywhere from 20/25 to 2400, and they would also show central vision that's affected. With the wet form, this is less common. It is subretinal. Findings would be shown. There is devastating vision loss. The useful vision can be lost in a few days, and it may occur alone or with the dry form. And with this patient, because she's still in the dry form, however, she did progress, we would see that she would also be complaining of metamorphopsia and photopsia, otherwise known as flashes of light in the central visual field. When looking at her fundus, there would also be drusen and subretinal fluid or RPE detachment associated with choroidal neovascular membrane. And as mentioned, CNVM is a key finding. This is where abnormal blood vessels break through the Brooks membrane. However, this is not always seen when looking at the fundus. And the wet form is, since it is less common, this is only seen in 10% of all ARMD cases. There's also devastating vision loss that can be from finger counting to hand motion. With the dry form, we have also found that ARMD is a leading cause of irreversible severe vision loss in the Western world in individuals over 60 years old, and our patient fits into this category. The risk factors for this condition is primarily the age, UV light exposure, positive family history, diets and accidents, however, can prevent this, and obesity, smoking, vascular problems, arteriosclerotic diseases, and it is more primarily in the Caucasian race.
So our plan for LW is to continue her on her current medication profile with folic acid and the AREDS2 formula, and we're going to include the fish oil, DHA, and EPA. We want her we would recommend that she eat green leafy vegetables and protect herself from the sun. That is a side effect of these meds.
For her follow-up, we would see this patient back every 6 to 12 months, watching any signs of the exudative wet form of ARMD. We are also suggesting that the patient take home her own Amsler grid with instructions to return if any changes are noted. If metamorphopsia are noted, this is more correlated with the CNVM, which is an indication of the wet form of ARMD. Patient would also be educated on signs and symptoms of ARMD, and to return to clinic if any changes are noted with her current disease state. With this patient, if she was having dramatic low vision, then we would give her some sort of low vision assistance by giving a higher add in her spectacles. We could also train her to use more of her vision and to give her low vision magnifiers. Since this patient was not seeing any such dramatic vision loss, we just stuck to the original plan of prescribing the green leafy vegetables, see her back often, 6 to 12 months, and to give her own answer grade.
Thank you very much.
Thank you.